There are more than 20,000 active cases of COVID in our province today, and almost 600 Albertans in hospital. Over the weekend, all schools in Fort McMurray were closed, and the municipality is moving to declare a state of local emergency. In some parts of the province, you can't get a COVID test for 4 days. These numbers have been steadily growing for weeks, and it's clear that more must be done to limit the spread of infection. One critical piece of that, an obvious piece, is that we can't have people going into work when they're sick. But for so many workers, staying home means losing weeks of wages, not being able to put food on the table for their families, or pay the bills. The Kenney government can't continue to put Alberta families in that position.
Today, I am proposing that the Alberta government provide every worker with up to 10 days or 2 work weeks of paid sick leave for themselves or a dependent. That means anyone who should stay home can stay home without any loss of or interruption of their income. Our proposal would replace, but be funded by, in part, the federal government's Canada Recovery Sickness Benefit. The reason we're suggesting this is because that benefit has several problems. For one, it only provides $500 a week. That is less than minimum wage in Alberta, and it is not enough for people to support most households. Secondly, it has a very bureaucratic and delayed application process. It takes a long time to get money to the worker if they're even eligible. And many families simply cannot afford to wait weeks without an income while they try to navigate the federal government's application process. This government doesn't have a clear position about what it wants to do. This premier has been communicating contradictory messages from day one, saying that people need to be safe, but that he's not going to do anything to make them be safe. That safety is one thing, but the economy is a bigger thing, and allowing his caucus members to actually undermine the merits of the safety rules in many cases. So this is a continuation of the same conflicted pattern that is leading to a repeat of an unfortunate achievement on the part of Alberta, which is to have the highest number of cases per capita once again in the country. Why is this happening? There's no good reason for Alberta to be in this position.